Why can't you sleep all night? Do you have deep questions spinning in your mind? Maybe it's the excitement of an important trip, an unfinished project, or the stress of an upcoming exam. Or maybe it's the dread of some tense family event. All of these could be pointing to a bigger issue: insomnia. Hello, everyone. My name is Dr. Syed M. Quadri, and I'm a U.S. board-certified psychiatrist. I've been working in this field for over 20 years. In today's video, we'll dive deep into insomnia, exploring all its aspects. I'll also share real-life examples of how my patients have overcome it, so you can understand it on a whole new level. So let's get started. The definition of insomnia is quite simple: difficulty falling asleep at night, or if you do fall asleep, trouble staying asleep. Essentially, it just means you're not able to sleep properly, which impacts your overall functioning in life. Many people think that not being able to sleep isn't a big deal, but that's a misconception. Insomnia can affect your entire life. The first impact is on your energy levels, making you feel tired the next day, lose focus at work, and reduce your motivation. You're unable to concentrate, aren't alert enough to pay attention, and get easily distracted. All of these symptoms affect you throughout the day, preventing you from fully living your life. Insomnia isn't just a health issue. It's a condition that affects both your mental and physical health. That's why it's essential to understand and treat it. Be sure to watch the video till the end, as I'll also explain how to overcome insomnia in this video. Now let's talk about the types of insomnia. Basically, there are two types of insomnia. Type 1, acute insomnia. This occurs when sleep is disturbed due to a specific stressor. Stress, exam, pressure, or a life event can cause difficulty falling asleep or staying asleep. This is generally short-term. Type 2, chronic insomnia. This is a long-term condition where people have been experiencing sleep difficulties for 3 months or longer. They face problems with falling asleep or staying asleep 3 to 4 times a week or even on a daily basis, which impacts their daily life the next day. Some people have trouble just falling asleep, known as a sleep onset issue, where they struggle to fall asleep at bedtime. Now, let's talk about sleep maintenance. Some people can fall asleep, but they have trouble maintaining their sleep throughout the night. In other words, they struggle to stay asleep. In the case of children, you may notice that they often don't want to go to bed at night. They seek more fun or entertainment, which increases behavioral issues and leads to sleep difficulties at night. You might be wondering about the causes of insomnia so that you can avoid those triggers. So let's look at the causes of insomnia. Causes of insomnia can be divided into two categories: medical conditions and psychiatric causes. Let's first take a look at the medical condition. Many people have undiagnosed sleep apnea, where they have trouble breathing at night, causing their sleep to be frequently interrupted. Additionally, chronic lung diseases like COPD or asthma and heart failure can also make it difficult to maintain sleep. Second, psychiatric reasons. People struggling with depression and anxiety often find it hard to stay asleep. Substance abuse, like misuse of alcohol or stimulants, also disrupts sleep. Alcohol may initially induce sleep, but after a few hours, it starts to disturb it. In the manic phase of bipolar disorder, people feel they don't need sleep, while ADHD patients struggle to sleep due to constant mental distraction. Correct diagnosis of these causes is essential for proper treatment of insomnia. People often misunderstand insomnia as just a simple sleep problem and start using over-the-counter drugs or sleeping pills, which can have a negative impact on the body. So, I strongly recommend consulting a doctor if you notice symptoms of insomnia. Now, I'll share some real-life examples to help you understand it better. Let's go through each one carefully. I'll first explain the patient's problem, then how I handled it, so pay close attention. A 15-year-old boy came with his parents, struggling with severe difficulty falling asleep at night. His parents had tried various remedies at home, like over-the-counter medicines and sleep hygiene, but the problem remained the same. After taking his history, I realized that his bedtime routine wasn't right, which was causing his insomnia. Now let's look at another example. A 55-year-old man came with his wife, experiencing frequent awakenings throughout the night. This cycle continued all night, which reduced his energy levels. He felt fatigued all day, couldn't focus at work, and sometimes even felt drowsy while driving. The problem had started gradually, but became more serious as his weight increased. Let's look at one last example. A 35-year-old woman who was anxious and stressed came to the clinic. She said that if she could sleep properly at night, most of her life's problems would be solved. Taking her history revealed that she was going through a divorce, which had become a major trigger affecting her sleep. Now, I'll explain how I handled it. For all three patients, I first took a basic history to understand their issues. I then recommended they see their primary care physician for a physical exam and basic labs to get a better understanding of the root cause of their insomnia. Each person's problem is different, so their treatments are also different. Let's talk about my first example. A 15-year-old boy was facing difficulty falling asleep. His parents mentioned that this problem had been present since he was young. Due to increased use of gadgets, he stays up late at night and struggles to wake up in the morning. His school performance was poor, and his grades were dropping. After reviewing his school records and speaking with his parents, I diagnosed him with attention deficit hyperactive disorder, ADHD. He had a poor attention span, was impulsive, and easily distracted. Along with therapy, we started medication to help improve his focus. I also prescribed something to help him sleep at night, which slowed his mind down a bit. This treatment showed dramatic improvement. His school performance and energy levels both improved, and most importantly, his self-esteem also increased. He no longer saw himself as a bad kid, and with therapy, we helped him manage his negative thoughts, resulting in overall better functioning. A 55-year-old man came with his wife, experiencing difficulty staying asleep at night. He kept waking up due to breathing issues. I recommended he see a primary care physician to evaluate him for sleep apnea. After taking his history, it was revealed that his windpipe collapses while sleeping, causing him to wake up suddenly. A sleep study confirmed he had sleep apnea, which was severely affecting his sleep. He was given a CPAP machine, which provides positive air pressure throughout the night to keep his windpipe open, allowing him to breathe comfortably. After this treatment, his energy levels significantly improved. Over time, he started eating healthily and losing weight. He also learned sleep hygiene techniques through therapy, which further enhanced his overall functioning. During follow-ups, he reported that his daily routine was much better and he felt more active. A 35-year-old woman came to the clinic reporting difficulty falling asleep and staying asleep. A physical exam revealed she was physically fine but was struggling with emotional stress. I suggested she see a therapist. During therapy, she understood her stressors and learned techniques to handle them. She adopted coping skills like deep breathing and meditation, which helped relax her body. She also learned some sleep hygiene techniques, such as relaxing before bed, taking a warm shower, and meditating, which improved her sleep. After a few therapy sessions, she showed improvement, but she continued to struggle due to her divorce and anxiety. She returned for a consultation, where I diagnosed her with generalized anxiety disorder. We started anxiety medication, along with something to aid her sleep. After 2 to 3 sessions, her mind calmed significantly, and she began effectively using her coping skills. The combination of medication and therapy was highly beneficial for her. Her sleep issues were resolved, and she no longer struggled with sleep. She was also managing her divorce-related stress more effectively and learned to handle her triggers with the therapist's help. So, these were 3 different examples of patients I see in my practice. Each one has a unique sleep issue, and therefore each treatment is also unique. The most important thing is to sit down and talk with a professional to understand what's going on with you. After ruling out medical causes once treatment starts, people often see improvements in their sleep. In my experience, while it may not be 100% perfect, there is usually a dramatic improvement, which significantly enhances their daily functioning and overall life. Now, you can understand why consulting a professional is so important, as sometimes we think we're not ill, but actually we are. When we get a proper checkup, a lot of underlying issues come to light. I hope you really enjoyed this video. If you want me to make more videos like this, where I explain things in detail, please like the video, subscribe to the channel, and don't forget to share the video so this information reaches others. Thank you.